going on, guys? My name is David, personal trainer here at Crunch Fitness in Placentia. This is Dwayne, also another personal trainer. Today we're talking about the biomechanics of the knee, the anatomy of the knee. Basically, you talk about overactive muscles, underactive muscles, through the overhead squat system done by NASM, and also some corrective exercises you can do to fix those imbalances in your knee. So first, let's go over basically the anatomy of the knee.
Alright, going over the skeletal system and the ligament system of the knee. Basically, you have your femur, patella, tibia, and fibula. Okay. You also have your ACL, which goes lateral to medial. You have your PCL, which goes from medial to lateral. You have your medial collateral ligament right here, and your lateral collateral ligament right here. Okay. Basically, going over the muscular system of the knee, you have your iliotibial tract, your vastus lateralis, your vastus intermedius actually turns into the quadricep tendon, your vastus medialis, and your sartorius muscle. Sartorius is actually the longest muscle group in your body. Okay. You also have your medial head, your gastrocnemius, the big portion of your calf, your anterior tibial muscles, and your long fibular muscle. Okay. Going to the posterior portion of it. Basically, you have your iliotibial tract again, short head of your bicep thigh. Basically, that is the short head of your bicep femoris. Your bicep femoris again, semitendinous muscle, your semimembranous muscle, and here's your gracilis muscle on top of basically your gastrocnemius again. Basically, all these muscles connect together to create movement for your knees.
All right, going back over the overhead squat system done by NASM. What you want to do, first look at the anterior portion. Basically, you want to have this, make sure his feet are pointing straight ahead, your shoulders apart. You put your hands high as possible you can, nice and straight. Basically, you got to do 5 squats and sitting down in the chair. So let's go ahead and see 5 squats, nice and slow. Okay? So basically, when I'm looking at the anterior portion, you want to make sure his knees are staying in front of his feet the entire time. You also want to make sure his feet are not turning outwards. Okay? So basically, going this is actually pretty good. Knees aren't really caving in. Let's go ahead and do something that's an overactive adductors. So let's see your knees start caving in. So let's see a couple more. So some clients that you have, you'll see the knees are actually caving in. See his left leg is actually kind of caving in. Basically, your body's one giant tug of war. You have your adductors right here and abductors right here. Okay? If you have an overactive muscle, the muscle is overpounding the other. It's going to pull those muscles in. So you go ahead and relax. Basically, what's going on is you have your adductors right here and abductors right here. Basically, if you have a shortened and overactive adductor, it's actually going to pull your knees in as you go down. Okay? And that's actually going to allow you to get less torque and less force from your abductors. So one thing you can do, what you should do, is stretch out your abductors and actually use something called self-myofascial release, which is actually foam rolling. That's going to help you loosen up those adductors. And also what you want to do, you want to strengthen your abductors, especially the glute medius and glute maximus. So right now we're going to go over some workouts that you can do to help you strengthen your glute maximus and glute medius and abductors. So you need to right in front of your feet the entire time to prevent injury, on top of make sure you get the most muscular involvement as possible. Okay? Alright, so that's a wrap. Alright, so today we're actually going to go over something called the X-Walk. Next got rid of Dwayne, so you guys have a lap attack. This is Mario, personal trainer here at Crunch. X-Walk, basically what you're going to do, have the client grab the elastic band, basically put both feet in the middle of the elastic band, feet shoulder apart, so it's pointing straight ahead. You have the client make X, the elastic band, go up to your hips, knees elastic band, pop the butt out, and it's basically take a giant step from side to side, okay? Just like that. Basically what's happening is your glute medius, your glute maximus is actually firing, and he's doing the X-walk. Okay, so you have the client basically do 10 on one side and 10 on the opposite side. So where are you going there? Upper glute here, building your glutes, perfect. So basically doing this is going to help you strengthen your glute medius and glute maximus, and it's going to help you with the knees caving in, doing overhead squats, doing your squats. Okay? So that's one workout. It's the next workout, something called step up to balance. You see how Mario standing right here, right against the box. So he's going to put his right leg on top of the box, left leg all the way up against the box, left foot touching. He's going to squeeze your glutes as tight as you can, bring your foot a little forward. Squeeze your glutes as tight as you can, bring your leg button back to your spine. Push off his heel, try to release straight up, and touch my hand. Right? Tap straight up, hold it for 2 seconds, slowly bring it back down, and back up. It's going to be exhale through the mouth as you come up, inhale through the nose as you go down. Basically working on basically glute strength as well as knee mobility and stability. Okay? So basically you have a client do 10, whatever you want to do, switch sides, do the exact same amount of reps. Alright? Thanks for watching my video. Hope you guys see you in the next one. Now the client hold it, basically put both feet right in the middle of the elastic band. He doesn't like the reset.
Go.
So one workout you can do is called Xbox. Basically what you're going to do, you got